As more people are infected with and recover from COVID-19, some are experiencing lingering symptoms. People who were hospitalized sometimes needing rehabilitation and further assistance following that. Our Alyssa Donovan explains the long-term impacts of COVID-19 that some patients are still dealing with months after their initial infection.
While many people infected with coronavirus experience just a few weeks of symptoms, there are some people who are not as lucky. Some patients experience months worth of symptoms and still can't return to their normal life. Pulmonary critical care doctor Sikandar Khan has worked with patients who were treated in the intensive care unit for COVID-19, then sent to a rehab center before finally returning home.
A lot of them, even 3 months after leaving the hospital or leaving rehab, are still facing a lot of day-to-day challenges in their health.
Recognizing lingering symptoms in patients, IU Health opened the ICU Survivor Center in June, a clinic for long-term COVID-19 patients.
So we can continue to help them for the 1 or 2 years or even longer that it takes to really get back to how they were before they got critically ill.
Dr. Khan says about 60% of patients they've seen complain about quality of life problems months after having coronavirus. 40% are still experiencing fatigue and stamina issues. And many patients are also developing mental health problems like new depression, new anxiety, or PTSD symptoms. Some are also having trouble with memory and thinking.
For our younger patients in particular, hair loss has been very concerning. Again, about 60% of our patients have had a lot of hair loss after surviving the ICU.
A symptom that Dr. Khan says is related to the initial inflammation during the infection, and the body will recover from in time. However, certain impacts on patients will be lifelong.
For things where the lungs have become scarred, that is usually permanent. If they've had injury to organs, which causes scarring and permanent damage, we don't think that will completely go away.
Leaving those hit hardest by the virus to live a life that will never return to normal. I'm Alyssa Donovan, WRTV.
Doctors say the months to years-long recovery from COVID-19 for some patients should serve as an eye-opening reminder of why wearing masks and social distancing is so important.
Today in the governor's weekly update, state leaders reiterated the importance of keeping your distance from people not in your household this holiday season. State Health Commissioner Dr. Christina Bach says Indiana's positivity rate is still going up. And while this may mean some seats are empty from people who couldn't travel to Thanksgiving dinner, she said to keep this in mind.
There will be more than 5,000 empty seats at Indiana Thanksgiving tables this year because of COVID-19. Let's all make those hard choices to prevent that number from growing so that Hoosier families are able to celebrate for years to come.
To date, at least 4,830 Hoosiers have died with COVID-19, and each day brings dozens of more reported deaths. Over half of those victims were 80 or older. The traditional drumstick dash is still on this Thanksgiving. The race, held every Thanksgiving morning in downtown Indy for the past 18 years, is moving forward despite the rising COVID-19 cases. WRTV's Stephanie Wade caught up with race organizers to learn about their safety plan for the holiday event.
It's such a tradition, not just for the running community, but I think for the Indianapolis community.
The race will go on.